Hello and welcome back to Anti-Aging Insights. Today, we are diving into something that's become way too common, and that is the overdone look. Puffy cheeks, frozen foreheads, duck lips, you name it, you've seen it. And today, we're going to talk about why less is actually more and why subtle is the new sexy. So let's take a few moments and talk about why does this happen? Probably the most common reason is pressure, peer pressure. Think about social media and the filters and the celebrities and the endless touch-ups. We see it all the time. And actually, if you want to learn more about how social media actually affects our aesthetic treatments and the way that people perceive the aesthetic treatments that they want to get, I've done a podcast recently on that, and you can go back and check that out. But here's the thing. With this pressure and these aesthetic changes that people see and want, they get dopamine hits from these small aesthetic changes. And what tends to happen is people start with a subtle treatment, they get that dopamine hit, and then they like that feeling and they chase it more and more and more. The problem with only treating the surface versus understanding the structure and the proportion and the more holistic approach to aesthetics is that you run into this challenge where more doesn't always equal better. In fact, more can often equal distortion in a person's natural features. And that's why it's really, really important to think about if what you are desiring is something that is going to be overdone. So what does that look like if you have something that's overdone or you see somebody that's overdone? Well, you can probably pick them out pretty easily. But some of the most common signs of this are, well, for one, loss of natural facial movement. So this would specifically refer to, but not always, but typically refer to treatments with neurotoxin or neuromodulator or Botox. When you are overtreated, you lose the natural movement of the face. You lose the expressions that you can make. And that simply is overdone in my books. You can also see shadows or puffiness in the wrong places. So that's often something that you'll see when there's too much filler put in, because you get that puffiness. Or when you have puffiness, then just underneath those contours where that filler has been placed, you get some shadows. And those are often in the wrong places, meaning it's not anatomically natural. So in other words, the face doesn't match the rest of the body or the age of the person. So when features start to blend instead of standing out, that's what we're going for. We're going for a natural look where the features do complement the facial anatomy. But when they start to stand out on their own, then we're looking at something that has become overdone. Typically, these overdone treatments can look decent in selfies, but not in real life. And the thing is, as a practitioner, when a patient comes in and they've had a treatment previously and they're asking for more, one of the problems is that that patient is living with the way that their current treatment is, and they don't often notice the gradual progression from something that is natural to something that is overdone. And so it's a lot on the practitioner to help the patient to understand what would be considered natural and what would be considered overdone. All right, so how do we do this? Well, my philosophy really is a subtle approach. It's sculpted confidence, not artificial changes. We want to highlight things that enhance your natural features. We don't want to highlight or bring attention to features that are not natural for you. That is not natural. That is artificial by definition. And so it's all about having a customized plan based on the anatomy, based on the age, based on the person, based on the gender, based on the lifestyle, and so many other things, which is why it needs to be customized and it can't be a cookie cutter approach. Natural, in my mind, means timeless. You shouldn't look like you're done, certainly shouldn't look like you're overdone. you should look like you are refreshed. And so we need to focus on things like the skin. We need to focus on the structure, of course. We need to focus on small tweaks over time, but nothing that gets layered upon layer upon layer upon layer of treatment that eventually goes from that natural look to the overdone look. In my mind, subtle work, natural work, great work results in you getting compliments like, you look like you've got a lot of rest, or have you been on vacation recently? It's that type of comment that is not pointing out overdone features, but how you look overall, which is a very natural way to experience this. So what are some of the things to watch for as a practitioner and as a patient? So think about if you have been having these types of thoughts. One of these is you feel like you need to keep topping up filler every few months because filler lasts longer than every few months. And if you have to keep topping it up, then we're actually dealing with what I described earlier, where we're getting layer of filler upon layer of filler upon layer of filler. And sooner or later, that's going to start to look unnatural. Another thing is if you are relying on filters before you even take a photo, because what this indicates is that you may be looking for something that is not what you're seeing in your own skin at the current time. And that may or may not be a realistic treatment to pursue, but oftentimes it can be an indication that we're getting into that realm of overdone treatments. The other thing that you may experience is if your close friends or family notice that something looks off, maybe they are making comments about that. That clearly is an indication that something may have been overdone. And from the injector perspective, if you see an injector that is pushing high volumes or aggressive plans, really think carefully about if that is the type of treatment that you want. Because again, that could be, maybe not, but could be pushing you in a direction of a treatment that is not necessarily going to be natural. So I want to summarize a little bit about my approach. I believe that every face is unique and treatments should reflect that. I always start with a conversation and a mirror. We look and talk about what your priorities are, but we also have to prioritize harmony. We have to prioritize proportion. We have to prioritize natural movement. We want natural looking results for your age. And we want treatments, of course, that are easy for you to maintain. And here's the bottom line. It's about enhancing your confidence, not erasing or changing who you are. And so if you're ever worried about looking too done, first of all, you're not alone and you don't have to go down that path. Subtle is powerful, subtle is sexy, and subtle is what lasts. And so I want you to remember that. I want to thank you for tuning in to this episode of Anti-Aging Insights. And if you are looking for ways that I can help you with your treatments, then of course, feel free to reach out to me. I'm on Instagram at Dr. Teri Fisher. And of course, you can reach out to me at antiagingvancouver.com. So that's it. And I look forward to speaking with you again really soon. And again, as always, I believe in sculpted confidence. That's the best way for us to treat ourselves. Take care.